Sound check. Check 1, check 2.
And here he is, Brian.
Hey. Hello.
Hello.
Great to be back.
It's good to have you back, mate, and always a pleasure to have you. Remind us where you're joining us from in the US.
I am joining from Bloomington, Indiana.
Indiana.
The Midwest. Just south of Chicago.
Okay. For those who know their geography, and I'm not one of those. I know we've got Rebecca Martin. She's joining us tonight, and Rebecca's a regular here in the chat. She's joining us from Texas. And nice. Dean comes to us from Hawaii. He always chimes in with her aloha. Got people from all over the world. Thanks for hanging out, everyone. Brian. What is the last 12 months held for you?
It has been a wild ride. Lots of good things. Always some ups and downs for sure. And then our most recent interesting political situation, always in America. We've already talked about that. So let's stick to voice tonight.
We will not be talking politics on this show. People can seek out their own options in that sphere. There are enough politics within voice.
Plenty of politics within voice.
Plenty of politics within voice, which we're not going to even touch on that tonight. Tonight for you, midday for me. Whenever I invite a special guest on, including my regulars like yourself, I always ask, what's the hot topic for you at the moment? You know, what's got you burning? And your response to that question, the first thing, because you listed a few, but the first thing you came back with, let's talk about voice teams, putting a voice team together. And I thought, yeah, let's, because I'm a great believer in collaborating and multidisciplinary teams to the betterment of the formation of a singer. Mm-hmm. But I want to give you the first opportunity to talk about, when you use the term voice team, what are you referring to?
Yeah, it's a really it's a wide group of people that could possibly help you on your voice journey. So the first thing that comes to mind, obviously, for me is the health of the voice. So we would need somebody who can take care of that. So they're doctors, laryngologists, and speech language pathologists that would help out with that. And so finding through recommendations from fellow singers, doing the research, finding people in that area that understand the pressures of performance.
Yeah.
I think that's a key thing. We'll go more into that in a minute. And then also within your sort of the normal side of it, you need a voice teacher. But specifically, you need a voice teacher that's going to help coordinate the instrument, build and coordinate the muscles, and help you get to a point where you can say what you want to say and be the artistic person that you want to be. And then within that group, you also have coaches, and coaches are going to specifically focus on the music, the intention. I mean, voice teachers do this as well, so there's overlap there.
Yes.
So you do have to find a coach that will commune with your voice teacher and get a unified front. So there's coaches, and then there are also producers for those of us that record. You have to find producers that also can ultimately speak a similar language and fit well on your voice team. And then you also have managers, agents.
Yeah.
So it gets wider and wider. And those folks also have to understand the performance realm. They have to know when your agent is organizing a tour, for instance.
Yeah.
Right. And you're performing so many nights. You have to know when interviews can be scheduled and when they shouldn't be. And right. And you have to plan all these things. So I think in developing that, and we can take each one at a turn,
Yeah.
you really have to be discerning.
Yes.
We used the word last year, discernment.
Discernment. I love, one of the reasons why I love taking the approach of developing a team is in one sense, and I'll be interested to, because we didn't, which is typical of our conversations. We didn't talk about what we were going to talk about prior to the show. We just said, pick a topic. Okay, we'll run with that, and let's see where our conversation takes us. So we haven't aligned ourselves here prior to the show starting. But my thought around a voice team, particularly for beginner and intermediate singers, is often, not always, but often the singing teacher is the center cog that others attach themselves to. And I love the idea that for our students to think about it from the point of view, and this is what it's, I love it because it's the antithesis to the idea of the vocal singing teacher guru, which is so prevalent online, that one person can give you everything that you need, and unfortunately there are some people online who certainly their shop front window suggests that that's what they are setting up, that that they're going to be the one-stop shop for you, and I have never bought into that, which is why I get special guests onto the show. For one, is that it's so important that we have other voices speaking into our development besides just one. What are your, when you hear me describe it like that, what are your thoughts?
Yeah, I agree wholeheartedly. I think that that's a big part of it. Yes, the center of it is the voice teacher, and the voice teacher has to have people to whom they outsource.
Yes. Yeah.
Which includes the health part. So if there's, for instance, sometimes there can be physiological, like, coordination issues with a voice. And if you're working through those coordination issues, sometimes you don't need a trip to the doctor. You can just kind of try some things and say, oh, that clears up. As long as you have the right breath energy or the right resonance awareness, then that's fine. No need to go. But if you're trying everything and the voice still is struggling, then of course you need to have someone that can take a look at the voice up close, and that would be a laryngologist.
Yeah.
So,
and I think also, because we've got that medical angle, and it is important, as people are thinking about this subject, and one of the reasons I was a bit excited to talk about it is because it's often at this time of the year, certainly in the Southern Hemisphere, as our teaching year comes to a close and people are starting to think about their new year and how that's going to look, they're often thinking about singing lessons and forming that sort of approach to their development. And often you want to go looking for that singing teacher whose ego is mature enough to, firstly, as we said, recognize that they don't have all the answers, but more importantly, that they stay in their lane, that they don't try and give you a diagnosis of nodules in a lesson or,
exactly,
those sorts of things, that there are particular professionals who the singing teacher needs to send you to for those particularly in the medical field, particular outcomes. Can we first talk about the medical side of thing, and then we'll move into other groupings? Who would you put in the medical sort of sphere? You'd mentioned the laryngologist.
Yeah, laryngologist primary, and then within their team, they're speech language pathologists.
Yeah.
And the front line, if somebody has to have some kind of operation or something, they would be the people that would begin the rehabilitory process.
Yeah.
And well-versed in timing and when to start voicing and how to get the voice going, vibrating a little bit, and then how much time per hour, et cetera, et cetera.
Yeah.
And so that's great because it's regimented, and then they'll know when the handoff can happen, when to invite the back in.
Yeah.
They also, one thing I think that falls short a bit is I don't think they're always well versed in who the voice teacher is and to whom they're handing the patient off to.
Yeah.
As the client, I think we need to do better as an industry in figuring that out. And I think that's a hard topic to tackle because voice teaching, there is no particular method that someone could subscribe to. It's so there are too many moving parts. But there's some underlying information that I think all voice teachers should know, and all voice teachers don't know.
Yeah.
I think we just have to say that out loud. That is the case.
Yeah.
It doesn't mean you can't affect positive change with healthy voice.
Yeah.
But when there's some instabilities because of injury or recovering from injury, that oftentimes you need more of what's considered a singing voice specialist.
Yes.
Yes. And so I think, and that's not always the case. And so I think we need to, that's one thing that I keep pushing forward. I wrote an article with Christian Herbst years ago about, what does voice pedagogy need? And that was one of the things we pointed out.
Yeah.
We need to know what is the lane of a singing voice specialist or someone who can rehabilitate or a speech language pathologist or, all of these people. And, we're in the process, I think, of slowly but surely inventing a little bit more of a concrete plan.
Yeah. Yeah. I for many years, and I always double check this with the ENTs that I work in team with and the laryngologist, as well as the speechies that I've worked in team with. Here in Australia, we call them speech pathologists. In the US, they're speech and language pathologists. Is that the term?
Yes. Yeah.
And I, for a long time, referred to myself as a singing voice specialist because I have those learnt skills with working in team with these medical professionals over many years. More recently, I've come to delineate that a little further to refer to myself as a non-clinical singing voice specialist. And that's a term that came about through some work by Leda Skurs, who was very much advocated, because in the US, I believe that a singing voice specialist had to have a speech and language pathology degree, or that was the notion. The funny thing about that here in Australia is speech pathologists are not allowed to have the term specialist in their title. They're not allowed it.
Wow.
It's a part of their registration.
Yeah.
And so that's why many of us, there was a few of us in Australia that referred to us as singing voice specialists, because it was a term that we could take for our own. In the long term, though, I've started to refer myself as a non-clinical, which nominates that I don't have a speech and language pathology degree, but I do have a pretty high level of education around and experience around working with rehabilitative voices. And so I guess it's the challenge, isn't it, for the, let's call them consumers, to identify who is going to be the right person for me and how and for the care of and development of my voice. Have you got any advice for people who might be in search of that type of person?
Yeah, well, I mean, you just brought up a lot that I think we should tease through a bit. First of all, like I know I have worked with a lot of speech language pathologists to teach them about voice.
Yes.
So that's an issue that there is some training that's lacking there, because they only have so long. They only have so long to work with voice, and in many cases the degrees are one semester of voice in many cases.
Yes.
So again, we have a lot of work to do, And so I remember when I was in New York for 12 years, I worked with a few different voice centers, and I was on faculty at the New York University Voice Center. And I remember this was an issue even back then, which is now, I mean, I've been here for 10 years, I think.
Yeah.
It was an issue even back then, but the doctors that I worked with, they would just simply send a patient to me and say, go do your rehabilitation with Brian.
Yeah.
They never questioned it. They said it, and I felt really, uncomfortable because of some of the battles. But I think we should get to the bottom of it, and I think there would be a way to help the public know who has deeper level of training, and not just through the buddy system, but through proven clinical changes that happen with patients or something like if you, like you said, you work with a voice team,
Yes.
with doctors. And I believe they do this in England. There's at least one entity where they work so much in tandem that then there's a certificate at least that you can get.
Yeah.
That's kind of blessed, I believe, by the medical. Correct me if I'm wrong, please.
I'm trying to think of the group. I think they wrote the voice handbook. Was it called? Anyway, I know who you're talking about. Yeah.
So I think we need, in the different countries, we need something like that.
Yeah.
It's imperative that, because we need to know who to go to. And so I think some of it is just understanding the knowledge base that the person would have to have.
Yeah.
There's so much training a speech language pathologist or a speech pathologist gets that a singing teacher would never get. Neurological disorders, swallowing disorders. I mean, it's a lot they handle. It's amazing what they do.
It's such a diverse profession, speech pathology. Like
language acquisition, right? I mean, it's
massive.
So many things.
Which is why voice is such a small, piece of the pie. And to
understand kind of flow and flow dynamics, resistance of the vocal tract, transitional places throughout the range in vibratory mode and minor changes like that, and acoustical transitions that are made. That takes a long time to sit with that.
It does.
So those of us who've been doing this I'm now at, I think, 34 years.
34 for you?
I'm not that old. Yeah, I'm 54. But 34 years. My first voice lesson was in my 20s that I taught.
Yeah.
Probably was not a very good lesson.
Well, you're 4 years ahead of me. I'm 30 starting in the new year.
Hey, all right.
Yeah, I'm chasing you. I'm chasing.
I'll take 4 years off so we can be even.
I bet you would. Yeah.
But there are things you learn if you are joined with the land of science, and you have friends like Johann Sundberg and all these great people, that you learn certain things that are imperative, I think, in knowing detailed a voice adjustment.
Yeah.
There's no way you can get it unless you've got this wide voice team. So I think that someone, depending on their needs to think about that. What do they need? Are they already pretty well coordinated and they need someone that's closer to like a coach level?
Yeah.
Or do they need a technician to re-coordinate? And then based on that assessment, their own assessment, they need to then search out somebody that's got that skill set.
Let's pull out of that opportunity to get bogged down. Let's pull out. Can I add another person into that sort of medical field? Actually, there's probably two. The first one would be a physiotherapist. Yes. No, and the second one is going to be that. The first one's going to be a physiotherapist. I think you don't call them physiotherapists in the US, do you? You call them...
I do sometimes because I work with a lot of people from outside of the U.S.
Right,
we have physical therapists.
Physical therapists, yeah. And that's becoming and I have a number of students currently who are very intentionally working with particularly TMJ work, temporomandibular joint, but also shoulder, neck. So important to have all of that in balance. So I think they can be a really fantastic addition to your team. But
especially if they specialize in laryngeal massage and know all of the components, and some that they do the massage inside the mouth. Y'all, I mean, it's a specialized field, and that can be valuable.
Let's emphasize that is a highly specialized field, and there actually aren't all that too many people who can do that work. And so I would be really encouraging you to do your homework. If you're finding someone that is doing laryngeal massage and whatever, I think a lot of that work has come out of the UK again. There's been osteopaths that have done a lot of work in that space, haven't there?
Definitely.
Yeah.
Yep. That's the center, and then they're quite well. They're more and more in New York and areas like that, and so I always follow that. But
Yeah.
but even the students that I have that are centered in New York are always looking. Like there are two that I tend to outsource to in the city, but not many.
Not many.
So,
No, it is a highly specialized field, as is the next one. We both pointed at our brain, the psychology aspect. Do you want to unpack that a little bit for us, and why a psychologist or a therapist who specializes in performance and those sorts of things, why they might be an important part of a voice team that you're putting together?
Yeah, I think one of the biggest things that impacts us as performers is our mindset. So we end up being burdened sometimes by our voice identity that comes from childhood, and to kind of dig through that, it takes a trained professional to dig deeply into why someone might have a negative impression of their own voice, or they feel too vulnerable to share the way you need to share with your voice, and so they chronically kind of hold on or tighten up on their voice. Other people who have been through trauma, and that it adversely affects their voice. I've had many students like that, where it's really difficult. You try all the things you can to get them to flow more and all these things, and what they really need is to sort through some very, very difficult things that they've been through. And so again, having someone on the voice team that can sort through those things and help them out really ends up freeing up the voice. So I think that's a valuable thing. And then the next thing I'd say is on the performance end, performance anxiety is quite prevalent. Sometimes immediately when people get into performing, and sometimes it comes after performing for a while. And it will sneak up on people and cause panic attacks. So having someone who's really well rooted and grounded in exercises to help avoid that, the kind of fight or flight reactions, and get a really good philosophical foundation and psychological foundation to pursue the career without that as a burden. It's already difficult enough without that, right? There's no way you're not going to be nervous. There's no way you're not going to have issues from sickness and things like that, or feel a little less than when you're singing with like the top singers in the world. Everybody has that, but there's a normal level of it that can be circumvented, and then there's another level that really holds people down. And so can I, and there's something I just want to that I was thinking about as you were talking there, that I don't want to, it's probably something that I would be better said at the end, but I just don't want to forget to say it, so I'm going to say it now. And that is, as we're talking through this, I think it's really important, as we were saying, that you find a singing teacher that can really act as that facilitator in one sense of this voice team that we're talking about. But can I equally say that if you are with a singing teacher who you really trust, but they are maybe not being responsive for whatever reason, not for no ill, but they're not responsive to some concerns that maybe you have got concerns around your jaw, or maybe you've got concerns about your sense of performance anxiety, that I know, Brian, you would also want to say that you have full permission to be the master of your own voice and your own destiny, and that you don't have to wait for a singing teacher to direct you to, XYZ support person, that you yourself should feel empowered and have the permission to seek these people out. And equally, I would encourage you to have that conversation with your singing teacher, because they may have people who they do work in team with that they can direct you to. You went to say something, Brian. Yeah, I think I just want to emphasize that. I mean, that's important. I think we always have to be our own advocate, you know.
Yes.
And I mean, I believe we talked about this in another one, but including with the medical world, you know,
Yep.
sometimes there's a blanket acceptance of what a doctor says.
Yeah.
And that I think, again, we should trust people that we work with, but also rely on our intuition and also do the deep dive and do
Yeah.
as much investigating as you can. In
Yes.
America, it's quite complicated just with all the crazy lawsuits that we've had over the years, for doctors to really think outside the box. So sometimes we have to think outside the box for ourselves.
Yes.
And definitely for a voice teacher, the voice teacher is trying to handle the best, you know, the best way they can, many students usually at once.
Yeah.
And so you bringing your own energy and your own concerns and your own dialogue and needs, that's important. So you have to advocate for yourself.
Yeah.
You know, and let me go one step further, because this comes to mind, and I feel like we've created a bit of a paranoid society as well. And again, this is a tough topic, where I think there's something wrong always in some people's minds, which again might then beg the therapist again to become part of the team earlier. I have more and more students like that these days. They come in and they're kind of obsessively worried about every little thing, and that gets in their way.
Interesting.
And they kind of don't trust the process. I'll give you an example, personal example. I had kind of a rough beginning with singing, a lot of pushing, and a lot of tensions that came about because of it. And then I found a tremendous technician, Dr. Barbara Dosher. And I remember as she was unraveling this mystery of like, what do we need to take away from Brian's voice or add? And was riffing like on a really high level. And I could tell changes were happening. But every once in a while I would notice like my jaw is sticking out. That probably shouldn't be happening, but she wouldn't say anything. Even if I mentioned it, she would just be like, just keep singing, you know? And nowadays, just keep singing would sometimes be viewed as an attack, you know, like, how dare you? I'm concerned about this. And in a sense, I just needed to keep singing.
Yeah.
And it worked itself out in a few months, you know? And there's no way to go from lack of coordination to full coordination. There's no way to go from, hey, my voice doesn't feel that good, to poof, it feels fantastic. So we have to know that someone has the knowledge base to field these things. So we got to do our research there. The person also who might have that knowledge base needs to welcome in the fears of their students and address them.
Yes.
Don't ignore them.
Yeah.
But maybe help them understand why that's not a concern right now.
Yeah.
I always tell my students, keep me posted. I know that you feel like this is an issue now, but keep me posted. I have a feeling in just a few weeks, this will be gone. It'll be like a wisps of smoke. And that is usually what happens. And if it's not, then you go and you outsource to the proper person.
Yeah, I love it. Such important, because you're right. We do get bogged down in problem, don't we? We fix and we fixate on them. And that can even make the problem seem and appear bigger than it actually is or will be. And I love that idea of just keep singing, just keep swimming, just keep swimming.
That's exactly just swimming. It is the same thing, and you uncover a lot of things by doing that. Now, of course, there are limits to that. Just keep singing with certain things, but you know, one of the trickiest things to get out of is muscle tension dysphonia. Right? There are lots of things that fall under that umbrella, neurological disorders as well. And that is very tricky. And so, again, you have to have multiple people involved in that as you unwind that area.
Absolutely. Let's pull out of, because I'm watching the time, Brian. You and I, we can get. Let's pull out of the medical sphere. Let's go down the professional development line, and the people that we might want to, you know, have gravitate to that aspect of a singer's development.
So you mean the voice teacher?
Yeah,
Or
but
the
now going
teachers?
down, like you started to talk about the performer, the manager, the producer, the recorder.
Yeah. So, for example, one of the examples I always use for my private studio, I have this really wonderful singer-songwriter, kind of like a like the young Joni Mitchell, sort of folky kind of things, and she's going in to do her, I think it was her third album, and she gets with a producer that says, "Gotta get a little bit more Janis Joplin," and I was like, "Huh?" Like this, it was the antithesis of this person's voice.
Yeah,
Like
yeah, yeah.
not even close. So we have to be careful about that, because
Yes.
there are lots of producers, and they know, again, it's about the staying in the lane. Producers know sound, they know how to put together things unlike anybody else, but many of them don't know voice as an
Yeah.
instrument, right?
Yeah.
That's a common theme, actually. There are many conductors who know music so well, intensely well, but they do not know voice as an instrument.
Yeah.
There are many coaches who know voice really well, but they do not know voice as an instrument. And
Yes.
there are many voice teachers as well that
Yeah.
might not know the voice as an instrument. And so again, we have to be careful with that. So when you're searching for an agent, we have to talk to the agent very specifically about what is best suited, what your voice is best suited for, and what areas you would like to be seen in.
Yeah.
That's a really important conversation. And I've had students who, and even if I say, I don't feel so comfortable with that, it's totally up to you, though. This is your life. In pretty much every case I can think of, they regretted heading down like, oh yeah, I'll audition for a rock musical when they don't sing rock.
Yeah.
Like that. So we have to be, again, there's where the discernment comes in. You don't want to put yourself in harm's way. You want to make sure you're proficient in rock before you audition for a rock musical. Yeah. What do you think?
I think that need for, before you step onto what can become a very fast moving train, if things go like we would like them to go, that you have really established that sense of artistic identity, and that you feel very assured in your ability to express agency, because you want to, when like you pointed out with the producer, it's, if you find yourself with the wrong producer, it's very, and I've been in the situation where you find yourself in a booth, a vocal booth, and you've got a producer saying, I want more of this, I want more of that. And in that moment, there can be a real pressure to please, to give the person on the other side of the glass what they're asking you for, because often time is money and there's pressure on.
Yep.
But to have that sense of identity to go, no, that's not what I'm about. This is what I'm about. This is what I want to, and for you to, in that moment, if the scenario allows, to really take ownership of the direction that your vocals is going to go in.
Yes.
Yeah. So that sense of artistic identity is so important. Again, this is why often the singing teacher is the starting point for many of these, tributaries that we're talking about, is because often a singing teacher is about helping you discover and develop and form that artistic identity.
That's right.
Yeah.
And I think along those lines, establishing a somewhat small group of people within this realm and the medical, all the areas that really know your voice as an instrument and your ideas as an artist.
Yeah.
They really know them more than any 15-minute audition that you'll do, right? Those folks don't know your voice. Any kind of competition we do, auditions and things like that.
Yeah.
Those folks might give you feedback, and that's fun.
Yes.
And can sometimes be helpful, but you need your voice team that knows your voice over the long haul to feel what should be, let's address that. We've heard that before, let's address it. Or, no, that's not really an issue with your voice. That's okay. They heard a snapshot of your voice. Maybe you were a little tired because of travel, or, and you can sort through it when you have developed a strong sense of who you are as an artist, and also your voice. And you've got this group that you trust,
Yes.
To validate that.
Can I say something that could be heard as being terribly controversial?
Uh-oh.
Uh-oh. Yeah, I should have special effects on this show for controversy. Da, 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 da. And that is that there's, back when I was doing my doctorate, I came across a quote which I'm not going to be able to quote directly, but it was from the World Health Organization, the WHO, and it was in the realm of voice and how the WHO at the time, I don't know if the document would still be up to date, but the classification of what got classified as a voice disability. Mm-hmm. And one of the things that determined whether it was a disability or just simply an abnormality was the actual person themselves recognizing that it was disabling them in some way. And so it spoke to the agency of the individual to go, well, yes, I have a rasp in my voice, but I don't see that as a disability. I don't see that as a problem. And here I am maintaining sound. This is where we get controversial, right? Because you and I, being people who have worked with people whose voices have, fallen into disrepair due to repetitive strain issues, right, could be alarmed by that and go, yes, but let me tell you, this is a problem. But yet the individual is going, no, it's not a problem to me. And this is, again, where I take that extra level to say, no, you have agency as the singer. It is your voice. It is not your singing teacher's voice. Now, with agency comes responsibility. And so I'm certainly not being dismissive of that. And I think as individuals who have agency, we do need to, it is wise to listen to our village and allow them to speak into our the development of our identity, but yet it is still our voice, and we get to decide certain things about what that's going to look like. Thoughts?
Yeah, I mean, yes. My thought is, just in general, if something's not getting in the way of what someone wants to do, then it's a non-issue.
Yeah.
In that moment, I think that we can provide the person with some expertise with that small, voice team that knows the voice, to say, hey, this is the issue, quote unquote, that you have. But if you don't feel like it's in your way, let's just watch it. That's what happens with most of the teams I work with.
Yes.
It's like, if you don't find this is an issue, let's see. The issue, though, is sometimes if you've got something that's causing a little bit of rasp on one side, on one vocal fold, and then it's hitting the other, it can start to cause a reactionary issue that then starts to really break down the voice. And so I think any human being that has agency, they can make the decision they want to make. So that's it. But I think they should do it informed by their voice team. Same thing with I always tell my students, singing multiple genres. I have a lot that sing professionally in at least 2, maybe 3 different genres. And I'll tell them, I'll say, hey, if you want to sing the most pristine version of this classical aria that requires fast coloratura, then belting probably is not the best thing for you, even though I'm very adamant about the fact that belt is pretty darn easy when you do it right.
Yeah.
And it's not going to injure your voice, but because of the resistance of it, it may slow down your coloratura and limit your ability to do really, really nuanced, decrescendo, crescendo. So I just say that, but I would never want to give up doing other genres just to be able to do, classical or whatever. So everybody has to make that decision. But I always think that we should encourage everyone to do it with the most information you can find, which we should make all decisions like that in life.
And I think it recognizes. So I would classify myself as a fairly risk averse person. I do go looking to mitigate risk in my life. Some people and some people are not risk averse. They want to fly as close to the sun as they possibly can, and let's see if I can get away with it. And that's often where you're saying, the way I say it is I often talk to them about the risk factors. Okay, so if you want to have that rasp and let's be frank, aesthetically it sounds awesome, but here are the potential risks with the prolonged use of that vibratory mode of the vocal folds, producing the sound in that way, and that's how I'll often, But again, I wanted to really highlight again this sense of agency.
And as you were saying, then we say, here are the things we'd want to look out for.
Yeah, absolutely.
Might let us know that it's getting more difficult and that we need to do something different. That's it. Exactly. So it's joining forces and then, recognizing that everybody needs to come to the table in that decision, and especially the individual. And the needs to become as well informed as possible.
Yeah.
And respectfully question. I mean, that's the way I look at it.
Yes.
I think a healthy degree of skepticism is warranted most of the time, but also some open-mindedness as well is warranted as well. When you're trying to really dig in, find someone who you really trust, and then give them some leeway to help guide you down a path of deeper knowledge.
I haven't rolled this out for a little while, so I'll roll it out now. One of my soapboxes, and this is one of the reasons why I'm not a big fan of TV talent shows. Actually, I just understated that. I'm not just not a big fan. I despise them.
I knew you were fibbing. I knew it.
I was being diplomatic, Brian.
Sorry.
That is because actually agency is removed. It's removed from the very first day you sign the contract to be on the show. You have no agency. You are a bought individual at that point. And that's going to include the health of your voice. Anyway,
sign on for, I mean, in a lot of cases, it's crazy.
Yeah.
So I think, we have to be, and again, if somebody knows and they're going in their eyes wide open and they've done the research, they're like, hey, that could turn out really well for you, so, but go in at least knowing that what you're actually going to be encountering.
Agreed. Yeah. So with our small amount of time left, who did we leave off? Because we started to speak more agency around the artistic space with the artistic part of the team. Have we left anyone out? Who have we missed? Who can be a part of a voice development team?
Yeah, we did psychiatry, we did physiotherapist, we actually got a lot of folks here.
It's a big, and this is why I said on the thumbnail for today's video, it takes a village.
Yes, which that actually brings up one of I think the best things for a singer to do is to have a group with whom they sing. I often think of my studio class at the university or online studio classes that I'll do, where it gives people an opportunity to sing with other people who are being trained by the same person. And when they hear each other chiming in and saying, ooh, last time you sang, I don't even think you could do that, but that sounds great. And they're getting feedback from a somewhat like-minded group. That helps.
Yeah.
Because I think too many cooks in the kitchen can be very confusing for a student, but people who are trying to embark on a similar path, and they're going to say things spontaneously, So you can kind of sense that there's no BS in there. So spontaneous reaction to a performance, I think that is such an important way to build confidence and feel like your path is secure.
Yeah. So I think actually, if we were to classify that group as a singularity, they're your peers.
Yeah.
They're a part of this team as well, aren't they?
Yeah. And you do have to be discerning with the peers, like we
supportive peers.
Supportive peers that kind of understand the path that you're going on. That's really important. So like here I have a group, and it's all, right now at present, it usually is any undergrads, or it's usually quite a variety, but right now it's only master's, performance diploma, and doctoral students. And so they're all kind of on the, similar plane. And so that's really helpful.
Yeah.
That can be really helpful. I think when it's a too distant thing, sometimes they, older doctoral students may forget what it was like to be a freshman. They'll dive in with things they're working on. I'm not yet.
Not yet.
Yeah. Just give it and so then there's always that.
Let's just applaud the freshmen for getting on stage.
Exactly. They got up and saying, you stepped
up, dude. Well done.
Yeah. So it's different things we reward. So, but it's the peer group, but it is definitely a select peer group, because, opinions, everyone has them, and I think they're important, but not all of them are shaped by really fundamental aspects of what voice is. They're shaped by aesthetic preferences.
Yes.
Right. And we're all welcome to have aesthetic preferences, but quite frankly, some do not align with good voice function, for an individual.
Yeah.
And so you have to figure out what to rule out and what to rule in.
You do.
No.
Brian, I am very disappointed to tell you, time's up.
Man, wow. Okay, that was fast.
It's always fast. I mean, it's always fast with my special guests, but with you, it's like lightning fast. I was
gonna say that was like lightning fast, man.
And the reason I'm disappointed to tell you that is because it means that we're likely not to sit and chat like this for another 12 months.
Another 12 months. But as fast as it went by, it's going to seem like maybe a week or so.
and you'll be in your 35th year of teaching.
Yes, and you'll be in your 31st. Keep it going. We got this, man.
Oh dear.
But I can't thank you enough for having me on again. I love chatting with you, and again, love having you as a friend.
Yeah.
And so, thank you so much.
No, mate, Brian, you are one of my faves. You really are, and in part because I think we sing from the same hymn sheet, but you're just a top bloke. Like I said at the top of the show, you're just a great guy. So thank you,
man.
Thank you for joining us for the show today. And ladies and gentlemen, that's our final special guest for 2024. And actually, one of the reasons why Brian it's become a bit of a thing here on the show, we've been doing the live shows for, in 2 weeks when Linda comes on, Linda is a special guest, but she's kind of not. She's kind of part of the furniture. When Linda comes on, we'll talk through all the stats. I think we're up to 9 years for the show or something, some crazy amount. But one of the reasons why I love having Brian on as that sort of, bookend for the year is we finish with such maturity and wisdom and experience, and I could be accused of having a bit of a bromance with Brian, but I'll take it. He's a great guy. I hope you've enjoyed today's live hangout, and I hope you've got something from it. Voice teams are important, and I encourage you to develop and form those individuals within your vocal journey. And as we said, often your singing teacher is going to be that center cog that everyone else, orientates around. Next week, we're going to do our final Q&A, like final voice dedicated Q&A for the year. So don't miss that. We'll be hanging out. And then the week after that, we are going to do our final show for the year, because as for those of you who are new to the show, we always take December, January off. It gives me a break. It gives Linda a break. And we start the new year fresh and ready to go. I think we're coming into our 9th or 10th year. Linda will tell us in 2 weeks. So in that last week, in 2 weeks, that last show, Linda had this idea last year, and we're going to do it. It is going to be a Ask Dr. Dan anything. It does not have to be, voice related. You can ask me whether I went to why you'd want to know these things, but you might. And so I've reserved the right to respectfully not answer, just in case things get a bit weird. But nonetheless, I'm hoping we can have a bit of fun with it. So don't miss the last couple of shows, because I think they're going to be a lot of fun. I hope you have a great week, and as the year sort of rolls towards its ultimate climax. I hope you stay safe and healthy, and we'll see you next week. I'm Dr. Dan. Sing well.